And to give us an update on the measles and dengue cases, we're joined this morning by DOH Director for Disease Prevention and Control Bureau, Dr. Napoleon Arevalo. Good morning and welcome to New Day, Doctor.
Thank you. Good morning.
Now, the Secretary Francisco Duque III himself said that the measles outbreak is not yet over. Can you give us an update on the latest areas still experiencing this outbreak?
Yeah, the past weeks, the Department of Health, through our Secretary, Dr. Francisco Duque, already has declared an outbreak in 5 regions, that of the National Capital Region, Calabarzon, Region 3, 6, and 7. And to date, we already have 8,400 plus cases, as compared to that in 2018, the same period of time, about 2,300 cases.
Okay, now this 8,400 cases, Doctor, this is nationwide, no?
Yeah,
Not just those regions that you mentioned. Now, among those regions, which region has the highest number of cases?
Well, as I've said, this 5 regions identified, which were declared to be having outbreaks, are the ones with very high number of cases. And we are taking a look at not only the regions with high cases, but also the whole of the nation, because there are several regions we are closely watching likewise, so that we prevent outbreak, because there are regions with multiple provinces having cases, but there are regions probably 1 or 2 provinces having a number of cases, but the rest are down.
Okay, now among these cases, most of them are children, no? What are the fatality figures, naman, Doctor?
The most affected are the under 5 years old children, and that we already have, out of 8,400 cases, we already have 136 deaths. And out of the 8,400 cases, most of them are unvaccinated children. And the ones who died, 95 or more than 95% of them were unvaccinated. And a chunk would also say that there's no clear record whether these children had received immunization, measles immunization.
Now, Doctor, the last time Secretary Duque was here, he mentioned how more and more parents are having their children vaccinated dahil sa takot, because of the fear of getting measles. What are some of the efforts that the Department of Health is doing in order to bring this number of cases down?
Well, as early as of last year, in 2018, towards the end of the year, we already have seen that there are cases of measles, and regions were alerted, and that immunization, or the supplemental immunization, has been started late of last year, as well as in those areas having outbreak, areas having, or communities having outbreaks, outbreak response immunizations has been conducted. So we have started the nationwide measles campaign, immunization campaign, and we are targeting the 6 to 59 months old. Actually, the target for the routine immunization for measles is 9 months old to 59 months, but we have reduced it to 6 months because we saw that we're having cases below 9 months old. And we are also targeting the school children, that of grades 1 to 6, because we are seeing cases among this age group likewise. And the Department of Education and other partners are very supportive in helping us out in conducting the mass immunization, and of course our leg workers, the local government unit health workers.
Now, does the DOH see an end to this outbreak or this measles epidemic anytime soon?
When we started our mass immunization or our supplemental immunization late last year and then January, and now we are having the nationwide mass measles immunization, we hope to curb the outbreak in areas, and probably we expect a plateau or a decrease in the number of cases by May and June, hopefully, as we massively immunize children, who are our priorities. in particular those who have been missed in their routine immunization, as well as those defaulters who have received only 1 dose of measles because they should have received 2 doses of measles.
Now, the department has also tapped in the help of Senator Manny Pacquiao into helping encourage parents to have their kids vaccinated. How big of a help has this been?
Well, we are so grateful that the President himself, President Duterte, appealed to the parents, to the caregivers, to the mothers to have their children vaccinated of measles. And lately, you can see in our health promo and advocacy, the Secretary of Health, Secretary Duque, as well as Senator Pacquiao, are already on board in campaigning for or appealing for the mothers and caregivers to have their children immunized. So we are hopeful that this strategy in health promo would help us out, encourage families to bring their children to immunization. And we are having a big turnout in our mass immunization campaign. In fact, at NCR, we already have a 33% coverage of those targeted children.
Oh, that's good. That's good to hear, Doctor. Now, let's shift gears a little bit from measles onto dengue naman, Doctor. Now, there is an update on a rise on some areas of dengue cases. Should we be concerned of a looming epidemic or another outbreak of dengue?
Well, as of now, from the same period of time in 2018 and January to February 2019, we have 17,800 cases compared to that of 2018, the same period of time, 14,000. So there's an up a little bit, but we have alerted the regions who are having cases, and in fact, we are reactivating the dengue task force at the central level, and that together with the measles, we would not like to overlook dengue because it's endemic in the country, and that we wouldn't want to have a repeat of measles in dengue. That is why we are looking at strengthening or heightening our surveillance at the regional level down to the municipal level on dengue.
Right. Now, can you give us an update naman, Doctor, on the dengue vaccine? So we're all aware of the issue that has been going on, and even lately that the FDA has pretty much revoked any certificate, has revoked the license of dengue vaccine certificate of product registration after it failed to give some qualifications in order to move forward for this. In terms of this dengue vaccine, how important is this, or is it okay for the Filipino people to pretty much forget about it?
Where at this point in time is on inquiry, and that we are awaiting results of whatever the recommendations are. And if FDA has issues on the CPR, then as a matter of policy, we cannot procure anything, any commodity for that matter, if there's no certificate of product registration coming from the Food and Drug Administration.
Okay. Well, that was it. Thank you very much, Dr. Napoleon Arevalo from the Department of Health, Disease Prevention and Control Bureau.